हमारी पूरी फैमिली जो है वो टोटली होम्योपैथी पे है। और जहाँ तक मुझे याद है, मेरा जो बेटा है बड़ा, उसने तो 15 साल में कोई एंटीबायोटिक भी नहीं ली, क्योंकि वी ट्रस्ट होम्योपैथी एंड आई जनरली बिलीव दैट मुंबई इज़ सो लकी, इतने आउटस्टैंडिंग डॉक्टर्स और कहीं भी नहीं है। डॉक्टर शंकर जी इज़ हियर, सो व्हाट मोर टू से।
ये जो मूवी दिखाने जा रहे हैं और जो हो रहा है, इसमें बहुत सारे लोग आए हैं जो होम्योपैथी में बिलीव करते हैं, जिनको होम्योपैथी से फ़ायदा हुआ है। और ये एक किस्म का सेलिब्रेशन है कि हम सब मिलके, और इसके साथ साथ हमारे जो मॉडर्न मेडिकल डॉक्टर्स हैं जो ओपन माइंडेड हैं, वो भी आए हुए हैं यहाँ पे, कि हम कैसे साथ साथ काम करें पेशेंट्स के बेनिफिट के लिए, भलाई के लिए। तो इट्स अ ग्रेट मोमेंट हमारे लिए। तो ये बहुत महत्वपूर्ण मोमेंट है कि हम सब साथ में आए हैं। तो इंडिया में बहुत कुछ है होम्योपैथी के लिए। हमारे पास आयुष मिनिस्ट्री है, जो होम्योपैथी और अल्टरनेटिव सिस्टम्स के लिए एक मिनिस्ट्री बनाया गया है, जो दुनिया में एकमात्र ऐसा देश है। और इसके साथ साथ हमारे जो लॉज हैं वो होम्योपैथी के फेवर में हैं, और हमारे पास फार्मेसीज़ हैं, बुक्स हैं वगैरह, बहुत सारी चीज़ें होम्योपैथी के हित में हैं इंडिया में। लेकिन इसके साथ हमारा जो एजुकेशन सिस्टम है उसमें बहुत बड़ा एक चेंज लाना ज़रूरी है। हमारे जो कॉलेजेस के स्टैंडर्ड्स हैं उनको बढ़ाना, कॉलेज के बाद का जो क्लिनिकल ट्रेनिंग है जो होम्योपैथ को एक्चुअली होम्योपैथ बनाता है, क्योंकि होम्योपैथी एक आर्टिस्टिक सिस्टम है। इसमें एक दवा नहीं है सब एक बीमारी के लिए, देयर इज नॉट वन मेडिसिन। तो हम जो पेशेंट है उसका जो माइंड सेट है, उसका जो नेचर है, उसका स्वभाव, ये सब समझ के हमको दवा चुनना पड़ता है। ये आर्टिस्टिक काम है, और ये हमको एक अच्छे होम्योपैथ के अंडर रह के सीखना बहुत ज़रूरी है। तो ऐसे इंस्टीट्यूशंस बनाना, कॉलेजेस बनाना, जहाँ ऐसी जो स्किल और जो टेक्निक है वो होम्योपैथिक ग्रेजुएट्स को सिखाया जाए, ये बहुत ज़रूरी है। क्योंकि जो होम्योपैथी है इट कम्प्लीटली डिपेंड्स ऑन द स्किल ऑफ द होम्योपैथ। मैं ये बिल्कुल नहीं मानता हूँ कि होम्योपैथी स्लो है, क्योंकि मेरा जो एक्सपीरियंस है, अभी तो 35 साल हो गए, हम पेशेंट्स को एक्यूट में, क्रॉनिक में, सब स्थिति में देखते हैं, एंड वी आर एबल टू ब्रिंग अबाउट वेरी क्विक रिजल्ट्स। बट यस, जो हम क्रॉनिक बीमारी की ट्रीटमेंट करते हैं, रूमेटॉइड आर्थराइटिस है, अस्थमा है, एक्जिमा है, इसका जो है एक वीक में तो चेंज नहीं मिलेगा। आप स्टीरॉइड देंगे उसको और पेन किलर्स देंगे तो आपको तुरंत पेशेंट को आराम लगेगा, लेकिन जैसे वो दवा का असर ख़त्म होगा बीमारी वैसे के वैसे वापस आएगी। तो उसका जो डीप सीटेड ट्रीटमेंट है, जो जड़ से निकालने की बात है, उसको तो समय ज़रूर लगता है। हाँ, बट एक्यूट केसेस में होम्योपैथी क्विक रिजल्ट्स ज़रूर देता है। और हमने एपिडेमिक्स में और ऐसे ऐसे एक्यूट बीमारियों में वी आर एबल टू हेल्प इमीडिएटली। होम्योपैथी बेसिकली जो है दवा, हम आज तक सिम्टम्स के ऊपर दिया करते थे। पेशेंट को ये सिम्टम है, वो सिम्टम है, इससे कौन सी दवा मैच करती है, इसके आधार पे हम दवा देते थे। तो अभी लास्ट 20 साल में हमने थोड़ा संशोधन, रिसर्च करके ये निकाला कि और एक भी अप्रोच हो सकता है। पेशेंट्स के सिम्टम्स के साथ साथ उसका जो अनुभव है, एक्सपीरियंस है, वो अपनी बीमारी को कैसे एक्सपीरियंस करता है, हर एक सिचुएशन में उसके अंदर का अनुभव क्या है। तो एक आदमी बोल सकता है कि मुझे गुस्सा जल्दी आता है, ये तो सिम्टम हुआ, लेकिन उस गुस्से के दौरान उसके अंदर का अनुभव क्या है, इसको हम सेंसेशन बोलते हैं। और इस अनुभव के साथ साथ अगर हम सिम्टम को भी मैच करेंगे तो हमारा रिजल्ट्स पहले से कई गुना ज़्यादा अच्छा होता है। इसको हम सेंसेशन मेथड भी बोलते हैं। से अदर सॉन्ग हमने इसीलिए बनाया है या क्रिएट किया हुआ है, क्योंकि हम यंग होम्योपैथ्स को वो स्किल दे सके। वो वो लोग आके जो एक्सपर्ट होम्योपैथ्स हैं उनका केस टेकिंग, वो कैसे पेशेंट को सवाल करते हैं, उस जवाब से वो क्या समझते हैं, कैसे एनालाइज करते हैं, दवा कैसे मैच करते हैं और उस दवा का असर क्या होता है, वो लोग देख सकते हैं। और ये जो पूरा केस टेकिंग है उनको रिले किया जाता है लाइव ट्रांसमिशन से, और ये पूरी इंडिया में इसका ट्रांसमिशन होता है। तो अलग अलग जगह से लोग उस एक्सपर्ट का नॉलेज का फ़ायदा उठा सकते हैं और देख देख के वो सीख सकते हैं कि हमको कैसे केस लेना है, कैसे एनालाइज करना है, कैसे दवा निकालना है। तो इस हिसाब से उनका स्किल सेट बहुत ज़्यादा अच्छा हो जाता है। अदर सॉन्ग का मकसद यही है।
अदर सॉन्ग जो क्लिनिक और एकेडमी दोनों जो साथ में हमने अभी जिसके 6 साल हो गए, तो उसका मेन कारण वही है कि हम यहाँ जो हमारा सेटअप है, हमने जो इंटरनेशनली जो सबसे अच्छे एक्सपीरियंस्ड होम्योपैथिक डॉक्टर्स है, टीचर्स है, जैसे थॉट लीडर्स बोलते हैं, उन सबको हमने एक प्लेटफॉर्म पे लाके फिर उनके जो एक्सपीरियंस है, हाउ टू ट्रेन स्टूडेंट्स फ्रॉम देयर एक्सपीरियंस, जो हम लाइव केस ट्रेनिंग बोलते हैं, सो विच इज़ वन ऑफ इट्स काइंड। इंटरनेशनली ऐसे कोई जगह नहीं है, कोई प्लेटफॉर्म नहीं है जहाँ पे इतने जो अच्छे स्किल डॉक्टर्स कमिंग टुगेदर टू ट्रेन स्टूडेंट्स विद अ सिंगल पॉइंट एजेंडा। तो ये जो एकेडमी है उसमें हमारे लेवल्स हैं ट्रेनिंग के, राइट फ्रॉम स्टूडेंट से लेके प्रैक्टिशनर, सीनियर प्रैक्टिशनर्स, इवन इंटरनेशनल स्टूडेंट्स भी आते हैं फ्रॉम डिफरेंट कंट्रीज़ टू लर्न फ्रॉम दिस टीम ऑफ एक्सपर्ट डॉक्टर्स। तो ये तो एकेडमी, और जो क्लिनिक है वो जैसे एकेडमी का बैकबोन है। तो क्योंकि हम डायरेक्टली जो लाइव केस ट्रेनिंग करते हैं तो वो क्लिनिक उसको सपोर्ट करता है। तो क्लिनिक में भी देर आर अबाउट 30-35 वेरी एक्सपीरियंस्ड डॉक्टर्स हु आर देयर वर्किंग थ्रू आउट टू टेक केयर ऑफ पेशेंट्स। सो दिस
इतने एग्जाम्पल मैं अपनी फैमिली के दे सकता हूँ, बट एक चीज़ मैं कहना चाहूँगा कि लोग बोलते हैं, समझते सुन कि असर लेट होता है, बट इतने एग्जाम्पल्स मेरे खुद हैं। मेरे फादर की स्पॉन्टिलाइसिस वन डोज एंड इवेंट इन द इंडस्ट्री लाइक दिस, टेलिंग एवरीवन। सो ये तो इट्स पीपल, यू हैव टू ट्रस्ट। तो मैं तो ये बोलना चाहिए, यू मस्ट ट्रस्ट इट एंड यू मस्ट ट्रस्ट योर डॉक्टर। आई थिंक दैट इज़ वेरी इंपॉर्टेंट। सबसे इंपॉर्टेंट ट्रस्ट करना ज़रूरी है।
The reason I'm here is because homeopathy pretty much changed my life. I got acquainted with Dr. Rajan in 2010, and since then, not just from a physical point of view or from a disease point of view, but from being able to look at myself and look at life very differently, I think it's changed my entire approach. So that's the reason I'm here, because I think I've benefited hugely from it, and I hope that other people can do the same, because it's a wonderful science, it's a wonderful art, and I hope that we can spread the message.
I remember I was 7 years old when my mother was rushed to some hospital, and no one knew what was wrong with her. So I remember night में करीब 2 बजे the doctor said we have to open her tummy, and I remember my father very upset, I remember him saying that close everything, I'm taking her to senior Mr. Batra. And ever since our family has been on homeopathy, and my son, I don't think my wife will tell you, for 15 years he's not taken any antibiotic. And at a personal level, no surgeries, nothing that in my experience, but I have to share my experience with Dr. Jayesh here. After having seen 3 big successes in my life, like everyone I met, I saw my biggest failure. My mother died in front of me, my father fell down in illness, and to be in such a panic state where you cannot leave home, you cannot take a step, you want to be in bed, you just don't know what to do. You have my mamas telling me antidepressants, family hair, this, that, that side. And to go to him and just sit with him just asking me to play the guitar outside his clinic. He told me I want to hear the guitar outside the clinic. whether it was healing, whether medicines, I really don't know, but I'm so happy today I can talk of failure. Otherwise everyone talks of successes. To such an extent that we made a film called Hum Saath Saath Hai, in which we insisted that we must get a homeopathy doctor in a scene to say that we cured it. I remember Dr. Majumdar from Bandra, he wrote the dialogues for us. And I must say here that when you take homeopathy, maybe the pain remains or whatever, but there is so much of sense of well-being. You feel it's okay. So that is the biggest thing in homeopathy, and whenever I go to Dr. Jayeshah's clinic, I always tell him, I always feel that homeopaths will make lovely filmmakers. Because as filmmakers, we are always concerned we चोर क्यों चोरी कर रहा है, not क्या चोरी कर रहा है. And a homeopath always says, ask that why are you feeling like this, not what you are feeling. So thank you so much for inviting us to see such a brilliant film. I envy this maker because of the passion that she has had, and it's really inspired all of us.
Pleasure to be here, and I feel very fortunate that I got this opportunity to meet great Dr. Shankran a few years ago, and the experience was just like magic. There were several, I met him regarding a health issue, but there were several things I did not discuss and mention to the doctor, but few months later, I experienced complete transformation. It's like a new life, healing mind, body and soul, not just the illness. So I feel really blessed that you are treated, a patient is treated by a doctor with so much compassion and sweet pills without any pain. So I'm very thankful to Dr. Shankran and his entire team. And after a few months, I also had this experience that many times in emergency I used to discuss with Dr. Shama about my symptoms. And without taking any medicine, I realized that symptoms would just suddenly disappear. So that is the power of homeopathy, that later on your immunity becomes so strong and mentally it makes you a better person. And after meeting all the homeopaths, I feel the world is a beautiful place. So, very happy to be here, and I would like to congratulate the makers of the film and good wishes to all homeopaths. Thank you so much.
I think if I remember correctly, उसने सिलीशिया नाम की कोई दवाई दी. The whole damn thing cleared so beautifully without any surgery. अब ये बताइए कि प्लेसेबो इफेक्ट, डॉक्टर आनंद किसी डॉक्टर के पास गया अपनी बीमारी के लिए और वो डॉक्टर इतना अच्छा है कि हम कहते हैं डॉक्टर साहब आपको तो देख के ही आधे ठीक हो जाते हैं.
For that absolutely amazing and entertaining talk, and we really respect him as our guide, as our elder, And we are so happy to be living in a country which has such open-minded modern medical practitioners like India. We are very grateful for that. Because I think the basic philosophy of India has always been that if I am right, it does not mean that you are wrong. Or if you are right, it doesn't mean I am wrong. We can both be right and we can both have our place. That's why India is a country of such beautiful harmony and diversity. And definitely, as medical practitioners, our aim should be to help the patient. Doesn't matter which pathy the patient follows. And if we can integrate the modern medicine and homeopathy, it would be absolutely the best thing for the patient. But before we do that, we need to understand what the difference actually is. The main word for modern medical doctors would be now specialists and super specialists. And what does specialist actually mean? Specialist means that you focus on a very specific part of the system. So you have, earlier we used to have ENT specialists, now we have ear specialists, then we have middle ear specialists, and now we have left middle ear specialists and right ear. So it's just a joke, but the idea is that there is a focus on the part of the body. And this is wonderful because you are able to understand what's going wrong with the different parts. There are diagnostic tools which are really advanced. There is surgery that's robotic. So it's amazing, and definitely we should take advantage of that. But what happens is, for most part, the chronic diseases especially, they don't find long-term solution in modern medicine. When you talk about arthritis, when you talk about asthma, when you talk about atopic dermatitis, when you talk about autism, there is no long-term solution. And the reason is, again, the idea of focusing on the part. For example, when we take rheumatoid arthritis as an example, we say rheumatoid arthritis is a joint problem, you go to the rheumatologist. But actually, rheumatoid arthritis is not a disease of the joints. It's a disease of the immune system. There is autoimmunity. That means your security guard, who is supposed to fight the robbers, is actually attacking your own self. That's the problem. And that attack is being shown in the joints. It may be shown as multiple sclerosis. It can be shown as systemic lupus erythematosus, any kind of disease. But the basic problem is not in the joint, it's not in the lung, it's not in the skin, it's in the immune system, which has gone haywire. Now, what does modern medicine do? When there is a flare-up, when there's a severe flare-up of asthma or arthritis, because it's an immune system problem, they give systemic immunosuppressants. Corticosteroids is one such. So steroids simply puts the immune system to sleep. Oh, you are the problem, go to sleep. It's like putting your security guard to sleep because he's gone crazy. But the moment he wakes up, he's going to do exactly the same thing. And that's the reason why modern medicine does not have a long-term solution. Because the basic problem, the crazy security guard still remains crazy. Now what does homeopathy do? Homeopathy understands that the immune system is not the problem. It is the whole system that is the problem. The immune system is a part of the whole. It's a part of a psycho, neuro, endocrine, immune system mechanism. It's like a cabinet of ministers. So you have the prime minister, which is the mind, then you have the defense minister, the immune system, the communication minister, which is the nervous system. They all work as a unit. And the policy of the cabinet is what is followed by all of these ministers. If the policy is an aggressive one, you have an aggressive mind, an aggressive immune system, an aggressive nervous system.
So when a person, for example, has severe struggle with himself, he's fighting with himself all the time, there are two parts of him that's going against each other. That is what is manifested as autoimmunity in the immune system. So basically, the idea of homeopathy is to look at the person as a whole by understanding who he is, how he thinks, how he feels, how he reacts, how he eats, how he drinks, how he sleeps. Because everything in him shows. So when you want to understand how a government works, you can see any department and you will see exactly the same idea. So instead of correcting each department, you go and correct the very policy at the center. And by doing that, you are finding a long-term solution to the problem. This is the basic difference. And definitely, there is a place for modern medicine. They have advanced diagnostic tools. They have surgery. For example, when something goes beyond control locally, you may need surgery. You may need local treatment. But we have to understand that that local treatment has to be backed up by treating the cause of the problem, which is in the entire system. By understanding how a person is, thinks, feels, reacts and dreams, how he eats, how he drinks, how he sleeps, you understand what's going on in the whole system. And when you treat that, then the entire system heals. The way of thinking changes. Modern medicine says stress is the cause of most problems. But what is the cause of stress? The cause of stress is not outside. The cause of stress is how an individual perceives reality. How he looks at and reacts to things, which is very individual. So the second principle of homeopathy is individualization. The first is treat the whole, treat the individual, and the third principle, which is the last one, is treat it with a remedy that matches the patient, that mirrors the patient, that has the same energy as the patient. This is called the law of similia. Homeos means similar, pathy means suffering. So you treat a patient with something that causes a similar suffering. So these are the, and of course potentization, which means our drugs are so ultra dilute that they can only act at an energy level and not produce any side effects. So these are the major differences, and when we put them together, for example, I can give you for example, there's a riot somewhere, there's a riot in Mumbai somewhere. Now you can say, this riot is a local problem, send the police, put a curfew and stop. But is the riot really a local problem? Is it not a manifestation of an underlying tension in the entire country which manifests at different places at different times? Unless the entire mentality of the country changes long term and there is harmony at a much deeper level, if we not address that problem, this riot is going to recur at other places at other times. That's the idea. So you may need a curfew for some time, but a curfew is not the solution, not the long-term solution. So we can have both working together and understand the scope and limitations too. The other question which Dr. Divya asked is about what is happening in homeopathy. And definitely I want to tell you that in the last 20-25 years, homeopathy has made unbelievable progress. Hahnemann stopped at proving 99 remedies, now we have 4,000. And in order to even remember this, we have developed extensive software, very sophisticated tools which help us. We have discovered new methodologies. First, we used to deal only with symptoms of the patient. Now we also understand what is experience of the patient. Aapka anubhav kya hai? Our patients are a little bit harassed by the question. What do you feel? How does it feel? And when they go into the experience, then their individuality comes out even more beautifully. And we are able to use this along with the symptoms, and the predictability of our results has exponentially increased. So we now come from a far more equipped, far more confident place than 20-25 years ago. And that's really heartwarming. The last thing I want to tell you is that we not only want integration of homeopathy with modern medicine, but we also look for integration of homeopathic treatment with other beautiful modalities of treatment, such as yoga, such as meditation, such as good diet, such as music, such as art. I think these are wonderful things. And the main thing I want to tell you is that when we talk of integration with other alternative medicines, it's not about giving homeopathy and adding something else to it. Do homeopathy and do yoga. Do homeopathy, do music. It's not like this. The idea is to understand the basic of all of them. And to be honest, the basic of most alternative therapies is homeopathy. For example, we talk of music therapy. We say music is healing. But which music is healing who? Which music will heal this particular patient? You can't play any music to anyone and say heal. It doesn't work. The music that is similar to your inner music, that is the homeopathic music for you. This was known 500 years ago. You know who was the first music therapist in the world? I believe it was Tansen.
I was informed that I should know when to get the speaker to stop.
You should know when to.
I assure you he's a better homeopath than you. Hippocrates said, don't look at the disease that the man has got, but look at the man that has been got by the disease. Just like he talked about the specialization, right here, inner ear, mid ear. There was a homeopath who was brought a patient who had gone into severe depression very suddenly and stopped talking. And he was asked what happened. He said he failed in the exam. So this homeopath who took individualization very seriously opened his computer, opened his books and said, by how many marks did he fail in the exam? While we were on the talk of autoimmune diseases, Dr. Mamdora has a lot of experience because a lot of the orthopedic and the arthritic ailments are autoimmune in nature, the seropositive, seronegative arthritis. So what is your experience with blending and integrating homeopathy and allopathy in these conditions, and where do you think is the scope and the limitation of this? And you can sing as well.
I can't sing as well as Dr. Shankar. Thanks a lot for being invited on the panel. It's a great honor to be on the same dais as my teacher, Dr. Anand. We have had a really enthralling experience together. Me and Nimish Mehta, we have worked for about 3 decades now together, treating musculoskeletal disorders. And I definitely feel that the integration and the harmony that we were talking about during the whole of this program is an absolutely urgent need. Because what we've seen in musculoskeletal disorders, though it looks only bone and joint, which looks very dry and very mechanical, but it's not so. It's a hugely lively situation where the mind plays a big role in maintenance and creating troubles. And since homeopathy looks at it from a holistic perspective, we have had some really gratifying results when we have been able to reach the problem as to why that situation arose or why that person reacted to a particular circumstance compared to someone else who didn't. So we've seen that autoimmunity is not just in situations of, as Dr. Shankaran said, of one particular single riot, but trying to understand how the whole situation has created a disturbance which is not looked at. As typically Dr. Nimish Mehta said, it's the tip of the iceberg we are looking at. Let's look at the 7/8 which is downstairs, which is not being seen. And if we see modern medicine and homeopathy, in that effect, there is a huge amount of similarity. It's unfortunate that we now live in an era of factionalism and fanaticism, where we try to say that I am a homeopath or I am a allopath, and we try to delineate the two. But the understanding of a pathophysiology or the pathogenesis of each disease has, when we see both together, we see a huge similarity. There is some disturbance in the environment, be it internal or external, which stimulates some problem to the system, and then the system reacts wrongly and creates a disease. Modern medicine will work in trying to suppress that or try to alter the mechanism, whereas modern homeopathy will try to relate to what was the reaction and change the reaction. So if you look at it at a deeper level, there is a huge amount of similarity, and the need for integration is huge. We are now at a time in era with huge amount of communications, all the kind of gadgetry available, but at the same time the factionalism is taking us apart. We need to make sure that these kind of integrated approaches are the need of the future of humankind. Because if we are able to gather all the knowledge is possible, as Organon says, try and utilize all knowledge available at my disposal to generate the problem, see what that problem is caused by, and hence come to some kind of conclusion by using all the diagnostics means from the modern medicine side, utilizing all the knowledges from the homeopathy side, utilizing the perspective from yoga or whatever, and get that whole integrated approach. And I have seen some really gratifying results. We have failures also, but that's what we learn from. I genuinely believe that we need systems or institutions supporting these kind of ventures where the integration can be generated to keep it with the times of the statistics and to keep in times of what is termed as evidence-based medicine, to show it to the modern medicine world that these things do work, because all of us have seen it work. It just needs to be translated into a language which the other modern medicine world or general people at large will relate to or will understand. Unfortunately, we have not been able to translate that language correctly. And that's what I feel is lacking. We need to work on that.
It's great. Yes, I did. It's very inspiring, and we needed this for awareness about homeopathy. Homeopathy is not just healing illness, but mind, body and soul, complete person. It is like spiritual healing. So
to spread the awareness, a movie was required, and I'm very happy that they have taken the initiative and congratulate the makers of the film. I experienced this few years ago when I was introduced to Dr. Shankaran, and that was the first time I tried homeopathy. It was complete miracle. So it was not just healing the particular illness, it is healing the entire person, the mind, because we go through a lot of stress in our lives. So we get the strength and the power to face any situation, and how we react to a certain situation, we become empowered spiritually and mentally. So we have experienced beautiful miracles with homeopathy. Just my best wishes to all homeopaths. They are very, very inspiring, and we feel that if we have such compassionate doctors who are treating patients with sweet pills, the world is such a beautiful place. Okay, thank you so much.
So I'm Mahesh Gandhi. I am a psychiatrist converted into homeopath. Actually, they are not different. In fact, if you're a psychiatrist, you can be a good homeopath, because mental symptoms, mind is very important, because we understand the patient, the person behind the illness. And mind plays a very important part, the person who he is. And if you have a psychiatric background, then it definitely helps you become even a better homeopath. See, when I began my practice, it was a very gradual transition. I was a psychiatrist. I gradually brought in homeopathy into my practice. And so I would initially treat panic disorders, anxiety disorders, mild depression, because I did not feel very confident to do treatment for major disorders. But by and by, now I'm 35 years in practice, and I'm treating all possible conditions, from panic to social phobia, to anxiety, to obsessive compulsive disorders, also bipolar disorders, and I have good cases even in schizophrenia. And many children cases where we don't have much answers, like autistic children, hyperactive children, attention deficit children, lot of behavioral problems. We have amazing results with homeopathy. In every case, basically, allopathy treats the expression of an illness. So in a way, it treats the symptoms, how the patient presents. So if I have anxiety, they will give you some medicine to remove your anxiety. If you have depression, they will give you some medicine to remove your depression, an antidepressant. Or if you have psychosis, an antipsychotic medicine. Homeopathy goes even further. Who is this person? How did it ever happen to him? What is it in him that makes him anxious? What is it in him that made him prone to depression? Or to a nervous breakdown, which you could call as something like schizophrenia. So we go deeper. We are treating the basic root cause of these illnesses, and not just the expression. So what a psychiatrist, or as a psychiatrist, what I would treat is, once it happens, how I can take care of all the symptoms that have come up. But this is something which is treating from within, all the very beginning, the source of the problem, and helping you, strengthen you, and make you a person where you become, in a way, more resistant to these sort of illnesses. There are numerous cases of panic disorder. The child or the person who doesn't go out of the house, become agoraphobic, becomes housebound, doesn't do anything at all. He is completely incapacitated and disabled, and there is so much of distress in him. He is not able to function in life. And such patients are now moving, working without any allopathic medication. So many children who could not concentrate in their studies, in their schools, and who were falling short, they were even advised to go to some special schools, are now doing very well in the normal schools and even excelling there. There are people with OCD who are all the time rushing, washing their hands, ordering things, could not function because they have repetitive, compulsive behavior or obsessive thoughts, which was completely spoiling their life. And now they are completely free and then can function. I have so many schizophrenics who have done very, very well. especially acute sort of schizophrenic or psychotic, and many whose medications have gone down. Most important is we work on the quality of the life of the person. After taking this, you see there's an amazing change in the person as he is and is functioning. Sometimes even better than what he was before he got the illness. Other song is very important. Other song is something that we only see our expressions, but we have to find out why are we different. You and me, we are all different. The whole world is made up of different people. So at one level we are humans who are same, but there is something in us which is very individual, very unique. And where does this come from? If we have all the same brain, the same type of body functions, how are we different? Because in our deep unconscious, we are looking through the eyes of something in this nature. We all know this. We say he's as sly as a fox, he is cunning like something, or he is like a snake. Or we say, why is he all the time trying to please people like a dog? Or why is he sensitive? All these unique characteristics we always deny. I cannot become like you, you cannot become like me. But this is because there is an inner program, an inner software, which makes us see the way we see life. And that inner program is what we call as the other side.
So I'm Dr. Divya Chabra, and I've been practicing homeopathy for over 20 years. I teach internationally, and I've been teaching homeopathy in the United States, in Canada, in Australia, New Zealand, Europe, England, and India, of course. Homeopathy, for me, over time, as I have realized, it's not just about that one pill or the medication that we take. Homeopathy is a philosophy that pervades your very life. Whatever we want to do in our lives, we have plans, we have goals, we think this is how I want to do it. And yet 10 years go by, and when you look back in your life and you say, you had a particular aim, but you landed somewhere completely different. What happened? What controls your decisions? What changes the path in a life which goes against what you consciously want? This in homeopathy we call the state. This state Jung called the unconscious that controls our lives. So patterns of our life that are destructive, that happen again and again, create unhappiness, and we are not able to stop them. You have a particular aim, but your decisions take you towards another goal. Emotionally, you're unhappy all the time. And finally, if all this does not get resolved at this phase, then it comes down to physical disease. Thus, when a patient comes to homeopathy, what we are looking for is not only taking care of his arthritis, but also changing that very block in his unconscious that is pervading and affecting his life in this negative way. Hahnemann says that when we cure, and the highest ideal of cure is to cure the patient so that his reason-dwelling, in-gifted mind will work towards the higher purpose of existence. And this higher purpose of existence is that ideal which is there in every human being, to be free of physical, mental and emotional disease so that you can do whatever you want in the best possible way and achieve your highest potential. That is the ultimate depth of the scope of homeopathy, and that's what we try to achieve for every person on this planet who comes to homeopathy.
Hitesh Mehta, and I am a diamantaire. My business is diamonds, and I am a staunch believer of homeopathy, and I'm a patient of Dr. Jayesh Shah. The film was amazing, and I think, many more initiatives like this should be taken so that, this can spread, and the understanding of homeopathy can spread around the world. So it is a very, very good initiative.
I'm Daksha Mehta, a great patron of homeopathy, and I think today's day was a wonderful integration of all the modern medicine, the homeopaths, all the senior ones, and this movie was very inspirational to see that how homeopathy really is globally there. The film was really very well made, and I think very it has reached out to a lot of the countries that are in this.
Rashmi Deshpande.
Ma'am, tell us about how homeopathy helped.
Homeopathy helped me. I used to get jerks which used to go through my left hand and my left leg. The intensity of jerks has certainly decreased, and the growth of my brain tumor has almost reduced by half from the time I've been taking homeopathy medication from Dr. Chatterjee. For about a year and a half, but I was detected with a brain tumor in 2011. Unfortunately, I went to Dr. Chatterjee a little late, but I wish I had gone to him a lot earlier.
Her convulsions were almost 4 to 5 minutes earlier on, and she used to have tremendous weakness in her leg. The convulsion intensity as well as frequency both have reduced drastically. Actually, she used to have entire half body convulsion. She has got brain tumor on her right side. Alright, so left side used to go in convulsion, but now with this homeopathic medication, ever since we started with Dr. Chatterjee, it is the hand convulsion completely gone. Leg also, the convulsions have remained only in ankle. That, as I said, intensity as well as frequency has reduced a lot. Temperament also is it is improving. I mean, she used to, because of her actually allopathic medication. I mean, temperamentally she is very sound and very stable, but because of allopathic medication, she used to be slightly irritable or mood changes are there. But that also is being taken care of.
In fact, it has been reducing at a good speed of.
It has become
half.
Rate of growth has become half.
Rate of growth has become half. And I'm due for an MRI in another couple of months. Yes, I delayed going to homeopathy a little late, and I almost believe that everybody, the moment they are detected with a tumor or any kind of a chronic illness, they should get started with homeopathy immediately. That's what I believe.
It was a relapsing case of brain tumor, and she was taking only anticonvulsive. And from my past experience, when convulsions are there, when the tumor is still remaining, it is very difficult to manage. But by the grace of God and her faith, conviction, confidence, support by her husband, the way she is progressing, simply fantastic. Not only tumor size is very slowly progressing, the way it was increasing faster. To be honest, there is no convulsion. Now she gets little aura only. And very happy in her field. Her son is getting married soon, balanced, confident. From every angle, she is doing very well. And no allopathy for neither chemo nor surgery. Only she is taking some anticonvulsive, and that also it is getting reduced. Unlike allopathy, in homeopathy, we address to the patient's main core issues. In short, we increase the immunity of the patient. We also advise for diet, exercise, holistic approach. So we don't attack the tumor by antibiotic or chemotherapy, but within body itself will fight with the tumor, and body itself will be able to address the platform on which tumor is growing, like stress factor, unresolved issues. And if that is taken care, a lot of awareness takes place, automatically body fights with the tumor and patient becomes healthier and healthier. A lot of autoimmune problem, even multiple sclerosis patient did very well, so many bronchial asthma, leukoderma. Autoimmune is our field, where body own immunity fails and so many complicated problem comes, like SLE, etc. And by the grace of God, we can handle that very confidently.